Thank you very much, Leslie, and thank you very much for giving me this opportunity to speak about Jhpiego's work. I feel most honored to share the stage with Gamal Sarur and with Lady Coptit and with Hema, and I thank all of you for being here and being Jhpiego's very, very good partners over 40 years. Now, I've been also part of this substantial history of Jhpiego, and I remember lots of things. For example, I remember that 25 years ago, we conducted a course which was called Academic Skills, and we were taught how to read the medical literature long before it became easy to refer to the Cochrane Library. And I know many of you in this audience took that course, and we became better at understanding medical science. I remember the critical study that we did in Thailand, in which Jhpiego showed how humanistic training using simulation could dramatically improve the confidence of providers while being kind to our patients. So I think that was very seminal in the way Jhpiego has grown. I recall the days when we tried conscious sedation. Does anybody remember that? As part of our anesthesia techniques in low resource settings for laparoscopy. And in Kenya, we had a particular type of conscious sedation which we called verbocaine or vocal local. Something that we still try today. Things that we may laugh at, but were very critical to our growth. I remember that we truly believed in those days that family planning was as much about containing fertility as it was about making sure that a woman who wanted a child could conceive. And so we taught tubal microsurgery as well as laparoscopic sterilization in the same breath, because we truly believed that was a woman's right. I remember how we took our infection prevention manual and it evolved out of Kisi in Kenya, and how we took the U technique that had been discovered in Indonesia and took it worldwide. So my colleagues from Indonesia remember the U technique came from your work, the alumni who are here, and we took it worldwide. A very, very important advancement for implants. I remember that we made the case for training for mini lab sterilization in the pre-service part of our education rather than in service, because we wanted every Kenyan physician, every Kenyan midwife to be able to perform these kinds of techniques, and transferring it into pre-service would ensure that we didn't have to do expensive in-service courses. It was really vital for really dramatically increase the number of people who could provide that service. So these are some of my memories about where Jhpiego has been. And during these years, we have seen so many countries graduate from developing country status to emerging economies. Countries such as South Korea, we were there many, many years ago. Countries such as Sri Lanka, Egypt, Thailand, Brazil. These are countries that have graduated from needing development assistance and are doing so many things on their own. We have seen hugely effective organizations grow following the support of Jhpiego, such as Pogi's Center for Training that really does a marvelous job these days all over Indonesia, and such as the Regional Quality of Care Center in Uganda. These are centers that have become eminent institutions as a result of many, many years of work over the years. So, and we have seen many of you who are Jhpiego's alumni become leaders of medical and midwifery schools, of ministries of health, and of regional and international organizations. But even as we celebrate our success, I think we must recognize that a huge unfinished agenda exists, and with many, many challenges that we have to overcome, opportunities that we have to exploit, and certainly approaches that we need to scale. As we look at this, we need to understand that our focus must be about scale, but not only coverage at scale, but we must insist on quality at scale and impact at scale. I think our future depends on us taking some of these things at scale. Coverage at scale, quality at scale, and impact at scale. This is an important task, not for pilot studies, but big programs. Now, if we really want universal access and coverage for all women at risk, I think we at Jhpiego believe that we have to take care to women and their families, in addition to ensuring that health facilities are capable of offering high quality services for women who can get them. So it is a combination of both taking care to women and providing care when women can come to us. And we have demonstrated this very, very well in one area that I have personally been involved in, ensuring near universal coverage for prevention of postpartum hemorrhage. In some of the most challenged countries in the world, Afghanistan and Nepal, we can achieve near universal coverage with urethrotics if we are willing to do community-based distribution of misoprostol. And we've demonstrated that this is safe, that this is possible, that this is low cost, that this is achievable in those countries. And we must continue to develop and scale up those interventions that we can take to the community, such as detection of preeclampsia with protein tests and blood pressure instruments designed for non-literate users. For example, youth and the young people. We have few programs that address the aging population. And now in developing nations, we have the increasing burden of non-communicable diseases. Our future direction must look at these vast gaps, because some of our best impact may come from addressing these pockets of need. So let me end by saying our one common theme for Jhpiego and all of the alumni that are gathered here today in this room is that we are in the business of creating change. We create change because the current situation regarding the high mortality and morbidity in our nations is unacceptable. We create change because the inequity in access to health care between poor and rich people is unacceptable in civilized nations. We create change because we already possess and have possessed for quite a while the scientific evidence and the technology for major interventions that can save millions of lives today. But most of all, we create change because we care. We care for women and their families. We care for women and their families wherever they are. We care for them whether they live in rural areas, whether they live in urban areas, whether they are able to reach our services, or whether we have to go and reach them with our services. We care for all of them. We care for women and their families, all of them. Friends, it has for me been a huge honor to be part of an organization that creates change and that cares. Thank you all very much.